This department is amazing. There are just so many opportunities to take advantage of, and they're not abstract and remote, they're tangible.
Everybody comes in at a different place, and that's okay. We're expecting it, and we're ready for that. The beauty is that we can give each resident the attention that they need.
A resident is just not passing through for 3 years. You're part of the fabric of the community. We want to know what's your passion in medicine, how can we help you achieve higher goals?
The UVM Internal Medicine Residency Program is not one size fits all, and so for any experience that a resident may be interested in, from medical education to research to global health, we really want to have a track record of succeeding in making that opportunity available.
I think it's rare to have an academic program like we are that is so supportive and collegial and interactive with each other between departments and also between fields of clinical medicine and research and QI. Like, all these things are integrated.
They're more than willing to create a unique opportunity or tailor experiences or tailor education to what someone wants to do.
But when people go out of their way to kind of prioritize what you are going through, I think that really speaks volumes in terms of the culture and like what people are really trying to do.
Attendings are always working on projects. When you talk with attendings and work with them, they get to know you and recognize when something might be something you would be interested in.
You could be walking by or working with an attending that you may not know has, 20 plus publications on a specific topic, and you could have just been mountain biking with them the weekend before and not know that.
I want to do women's health and cardiology, and just finding mentors in that field feels easier than it might be at other larger institutions, coupled with such a interdisciplinary and collaborative environment too. I feel like I'm really able to just form my own career path.
We cover such a large catchment area between the state of Vermont as well as portions of New Hampshire and upstate New York. The variety of presentations that we see and the variety of diseases that we see is so great that I think it's really beneficial for all of us to have that experience.
Internal medicine training really requires a balance of seeing lots of good standard bread and butter cases and learning how to take exceptional care of those patients, and seeing those rare zebras that are exciting and interesting and really push the boundaries of what we need to know. It's been really great. I've been here 6 years now, and we see cases from folks that live in Vermont, folks that have traveled from abroad. We have a large resettlement population in Burlington, and so we see a really awesome diversity of cases.
We have really highly functional teams. So we have excellent ancillary services at the hospital. In the outpatient setting, we're a patient-centered medical home. We have case management, social workers, pharmacists, nutritionists who are embedded in our clinics, and it just makes for an overall wonderful experience to manage your patients with this team of individuals.
Attendings are in-house and always available, but we really want residents to be having the flexibility and the room to be able to learn. And so we really try to graduate that autonomy as residents are going along in their training.
You kind of get the best of both worlds in that you're in an academic institution, but it's small enough that you get to know everybody. The fact that you kind of get to know people on a more personal level makes the work-life balance a lot easier, because there's a better understanding of each other and each other's personal lives, as well as, the goals that we have in our own professional life.
For me, it was a decision of, the program and the place, and Vermont was just like the perfect combination for me. I wanted to practice in a place where I would enjoy living, and, most importantly, I wanted to be a part of a program that was an academic center, that was cultivating, that enjoyed working with each other, and all of those things I saw through my interview, and definitely when I started working here.
Well, residency is challenging, but I think we create such a nurturing and supportive environment that our residents pretty much thrive during their training.
The program values our wellness, and that was also a very wonderful surprise.
Supportive is one of the top adjectives I would describe all across the board, in terms of education, mental health, balance. I think it's always about support, and that prioritization of, the learner and the residents really took it up in my mind in terms of why I wanted to be here.
If you want to be at a place with all the exceptional patient care opportunities one could imagine, world-class research and great medical education opportunities, and at the end of the day, be able to be in a beautiful place where you can go for a wonderful hike or run or swim in the lake UVM's an exceptional place.
It's actually exceeded our expectations in many ways, not only as the hospital and the program. Our hobbies and our personal life has flourished and blossomed and has exceeded our expectations of how much fun we can have outside the hospital as residents.
I have had no doubt since I met these people during my interview day that this was a space for me, because it allowed me to not only grow as a doctor, but grow as a person.
UVM is the best possible workplace environment that you could have in residency.
Every single aspect has been significantly better than I could have expected. It's hard to do it justice just talking about it until you get a chance to experience it.
You interview at 16 different places, and it's all over Zoom, and everybody's website looks the same. And so being able to find a place that has this spirit and this soul to it that can get across to you over that kind of medium, I think is really special.